Hi, I'm Naveen. I am a writer and a consultant for companies who are working in healthcare to make things better for patients. Healthcare is important to me because I think fundamentally it's just about helping people who need help. And if that's the goal, then I guess I really care about making sure that the system is actually helping people instead of making it harder for them when they need help, when they're sick, when they're injured. Healthcare's always been a part of my life. My dad's a doctor. I grew up wanting to be a doctor. I studied, I was pre-medicine, but wound up going into public health school and then getting into health policy. Uh, Became a patient advocate for a few years. Wound up doing market research and eventually started my own company. And along that journey, I think we all have our own healthcare stories. For me, it really it all came together when I had a back injury, and I'm sitting there trying to coordinate with my insurance company with multiple doctors, and you just experience firsthand how bad the system is at communicating, at following up, at sharing your data, making sure that you're getting the care you need, using technology that as a 20 something or 30 something we use in every other part of our life. Um, and I think that that's really served as a call to action to help the system figure out how to be better. At a simple level, hearing more stories about people who kind of hit the wall when it comes to working with their healthcare system to get their needs met, and how they overcame that challenge or those barriers and took things into their own hands and came up with a new approach or a new solution. Getting inspired, learning some new ideas for how patients can get their feedback and their lessons learned from their own experiences incorporated back into the system so that other patients who might be in a similar position won't have to go through that process of learning how to deal with it on their own.